Hello and welcome. My name is Lauren Scholler. I am one of the Education and Information Board members for Miles for Hips, and I'm joined by Dr. Michael O'Brien, who is a physical therapist at Melbourne Orthopedic Group Sports Medicine in Melbourne, Australia, who earned his PhD that investigated impairments and outcomes in adults with hip dysplasia. Michael is also a research fellow at La Trobe University, and over the past 15 years, his experience has included working in elite sport, hip research, teaching, and clinical work. He has published papers on surgical outcomes for hip dysplasia and strength and functional performance measures in football players with hip dysplasia, in addition to other topics. Thank you for taking the time to share your global perspective on hip dysplasia care. Can you start by telling us a little bit about yourself and how you came to be interested in hip dysplasia?
So I've been a physiotherapist originally trained in New Zealand and worked overseas in the UK and in another state in Australia, up in New South Wales, for a while before I then came to Melbourne, which is where I am now. When I moved to Melbourne, I very quickly started working for what we call here the Hip and Groin Clinic, which is a team of us physiotherapists, which like a special interest in the hip and groin space, and a lot of teaching in our space. It's run by my mentor, Andrew Wallace, and has a very close connection to some orthopedic surgeons, particularly out of Melbourne Orthopedic Group where I work, who have a large special interest and special skill set when it comes to hip dysplasia, including adult hip dysplasia. And so it was from working alongside these people for a while that I really started to develop an interest in this area as well. And I suppose I then took that into the research world where I did my PhD in adult hip dysplasia, and that finished up about 18 months ago, because I could see there was so much we didn't know in this space, and so wanted to help, I suppose, fill some of that gap. There's still a lot that we still don't know, but that's kind of how it all started. So yeah, I've been working at the Hip and Groin Clinic for like 8 or 9 years now. And now my role is a couple of days a week clinical still at Melbourne Orthopedic Group, and then 3 days a week where I am a postdoc researcher, where we're setting up a national hip dysplasia registry for Australia, and we're also looking at running a clinical trial involving physiotherapy and orthopedic surgery, particularly periostability osteotomy. And so we're hoping to get both of those off the ground this year as well.
Great, very exciting. Now, you mainly focus on adult hip dysplasia, but can you share information about how patients are screened or come to be diagnosed with hip dysplasia in Australia, or kind of how there are those later diagnosed hip dysplasias? What does that look like in Australia?
Yeah, so obviously we have, the kind of standard infant screening that we'd see in most Western countries that occurs, but that's not really kind of, I suppose, the population that I'm working with. It is more the adult population, a lot of teenagers, adolescents as well. And unfortunately, we probably don't have a great screening system here. I think the general pathway that a lot of people would gain diagnosis would be presenting to a general practitioner, a GP, or a physiotherapist with hip pain, and then essentially eventually not responding probably to primary methods of treatment. And then as they don't get better, potentially then needing some imaging, and that might be done by the GP or physiotherapist, or it might be you might be sent along to a sports physician who can often start that process as well. I suppose the thing that is relatively standard or encouraged, particularly by our group and others, is the type of x-rays that should be done on this population. And so we very much encourage that x-rays should be the primary choice of imaging in this population. We still see a lot of patients who have MRIs done first. So trying to encourage x-rays, particularly a standing weight-bearing AP pelvic view and also a false profile view. And I know that there's some conversations around the world on whether or not those are the best choice of views, but that is generally what is agreed upon amongst most of the experts, I would say, in Australia, if not all, would be that kind of pathway to diagnosis. If a patient isn't getting better, then obviously making their way to an orthopedic surgeon may be appropriate for further imaging. And and often MRIs might be done on that pathway as well. Most of the orthopedic surgeons, I would say, do encourage physiotherapy first and a trial of physiotherapy to see if we can settle patients' primary symptoms and functional problems as well. And then if that's not working, often trying analgesics, potential injection therapies, intra-articular cortisone injections or PRP are commonly offered to patients as well. And obviously, as a last resort, you do have orthopedic surgical procedures that are often offered to these patients as well.
Is it typically that the GP is the one reading these initial x-rays and identifying the hip dysplasia? I'm interested in knowing kind of what that pathway looks like for once they're diagnosed, how long does it take for them to reach an orthopedic surgeon that
Yeah, such a
specializes
good
in hip
question.
dysplasia?
Great question, and so variable. So essentially, the report will go back to whoever's ordered the X-ray. So let's say it's an X-ray. If the GP is the person that's ordered it, then yes, the report will go back to the GP. And obviously, GPs need a very wide variety of skills, and often they're not specialists in musculoskeletal disorders, and certainly maybe not adult hip dysplasia. So they'll probably generally rely on what the radiologist report is. And we know that, again, not anybody's fault at all, but adult hip dysplasia is commonly missed. And there's a paper out of New Zealand just a couple of years ago that was looking at a surgical population, and it showed that around 50% of patients who were having surgery for hip dysplasia didn't have any mention of hip dysplasia in their radiology report. So very commonly missed, unfortunately. In Australia, so physiotherapists can also refer for imaging. So if it has been referred to by a physiotherapist, then it's the physiotherapist's duty then to feed back that report or the results of that X-ray as well. When we're teaching, we do try and encourage physiotherapists to have some basic skills and trying to recognize hip dysplasia from an X-ray because of the high rate of misdiagnosis. Yeah, does that answer your question?
It does, yeah, and that's interesting. I think it is important to have physical therapists involved in that to help to identify those missed cases. So I think that's a really great initiative.
Yeah, and then it can be depending on your second part of your question was kind of how long then to see an orthopedic surgeon. So it probably varies again, public system versus private. Some of the orthopedic surgeons who have great expertise in this area do unfortunately have very long waiting lists, and that's privately and publicly. So it can take a while. Hopefully, often what we'll try and do is, and even the receptionists and the secretaries of the orthopedic surgeons may send them to us in the meantime. We have some basic skills in radiology and also being able to try and diagnose them, but more importantly, trying to reduce their symptoms, manage their issues, and perhaps even reduce the need for surgery down the track.
That's great. Now, I am also interested in knowing what priorities or opportunities there are for hip dysplasia related care, research, or education, specifically in Australia. And are you involved in any of these activities in your area to address those?
Yeah, absolutely. So we actually have a symposium coming up. So my postdoc research is through La Trobe University. We actually have a event that we are organizing currently called the Unstable Hip, where we're going to talk about hip dysplasia, instability, pelvic floor, and more. So that's on the 27th and the 28th of June. And that will be both online on the Friday evening and then also some face-to-face workshops on the Saturday, which I'll be helping to present at as well. And we've got orthopedic surgeons, radiologists, physiotherapists, so it should be great. So that's something that's exciting, and that's we'll actually be putting that out this week. The Hip and Groin Clinic, which I mentioned that I work for, my mentor Andrew Wallace runs, and we provide professional development courses and various events throughout the year as well. So that's the hipandgroinclinic.com. And so we're trying to push the information out as best we can through a variety of events, publications, editorials, all those types of things. And I just put one. I was first author on one with a great team that just got published in BJSM a couple of weeks ago, talking about athletes with hip dysplasia as well. So that's available. If anyone can't access it, just feel free to get in contact, and I'll send you a PDF.
That's wonderful. I'll definitely be looking out for that symposium and we'll share that information with our group and our audience. And the question that I would like to kind of leave us off on is what is your vision for the future of hip dysplasia?
I think one of the things that I would really like to see, and I talk a bit about this in the BJSM editorial, is international consensus when it comes to the diagnosis of hip dysplasia. I think we somewhat have that when we look at FAI syndrome. And I think it has really set up FAI syndrome research quite well because everyone can, regardless of which country you are in, kind of create a cohort that is relatively similar in terms of the diagnostic procedures. And what that then allows you to do is set up treatments specific to a specific cohort. And I think, unfortunately, with hip dysplasia at the moment, there is a lot of different opinions around what is considered hip dysplasia. So I would love to see some international diagnostic consensus. That would be one of my big priorities. And I think this would then help with the registries and everything that we're setting up as well. I think what that would then allow us to do is set up, okay, well, is physiotherapy effective for all these patients, or is it only effective for some patients, or is it only effective at certain stages of the disease? How long should we be doing physiotherapy for? And I think there are all those other questions that could then hopefully be answered once we have that diagnostic consensus. And then obviously similar to with surgery. When is surgery most appropriate? What surgery is most important? Should it always be a periacetabular osteotomy? Should we be doing concomitant hip arthroscopy during that same procedure? Should it be a few days before? Should it be a procedure that's done afterwards? So there's lots of questions and there's lots of research that is being done in this space. But I just think when the cohort that the research is being done on varies between various studies, it's very hard to then perform meta-analysis on these results. So I think trying to make sure that we're all speaking the same language, speaking about the same patients, even if that means dividing into subgroups, would be a great priority in this space.
Absolutely. And I think that goal of having an international consensus and a standardized approach is one that many people share. And I was talking with a surgeon from Mexico, he now practices in Texas as well, but he initially practiced in Mexico, Dr. Pablo Castaneda. And he was talking about how that's something that he would love to see is more of a standardized approach because it is so variable from one country to the next and all around the world. And so I think that's something that has really been highlighted throughout this series of getting the global perspective on hip dysplasia. So there are a lot of people working towards that, and I think it's certainly possible. So that would be exciting to see for sure.
Absolutely. Couldn't agree more.
Well, thank you so much for taking the time to share your perspective and what hip dysplasia care looks like in Australia. This has been really insightful and definitely looking forward to seeing what the future of hip dysplasia care holds. And again, just really impressed with the work that you're doing. So thank you so much.
Be, really beneficial to the wider international community. Really appreciate it.
Absolutely. Thanks.